Thanks, everybody, and welcome for joining another Federated Analytics webinar. Today is very exciting because we're going to have some exemplars of real-world problems using federated analysis and very special speakers today. We'll start with some updates from the FedA program. Before that, just some housekeeping. So we are recording the webinar, so if you need to go back to it or watch it later, it will be available in our website soon. There is a Q&A session during the webinar. You can post your questions there. I'll do my best to collate all of them and we'll answer as many as possible. If we cannot answer all of them, we are going to take note and then we'll put as many answers in the chat in the website as well, so you have access to them. Please, let's abide by the HDR values, and I hope you guys enjoyed the webinar. So over to you, Jonah, to give us some updates on the FedA program.
Cool. Thanks, Graciela. So for those who might be new to joining these drop-in sessions, or the Federated Analytics program is a partnership between Manchester University, University of Dundee, Swansea, and Nottingham, really focusing on the analysis part of Federation, and delivering solutions that enable interoperability across TREs. And doing this, we work across different collaborators internationally and nationally, namely a select few, DK, EOSC through the EOSC and Trust project, working with the CERT team based out in Swansea as well, and collaborating with various SUs through the NHS, and then as well as the Elixir through a lot of the adoption through of standards. Really, the Federated Analytics program is guided by this sort of goal at the bottom, or this mission is to transform how researchers securely access and analyze data across multiple locations. So I think with the advent of TREs the last few years and understanding the anxieties, I guess, around data sharing and how we can do this better or more efficiently, almost and more safely, we've worked in this federated analytics space. I know Ross and Owen will talk on this more in their context. Sort of diving deeper into the Federated Analytics program, these are our objectives. They're available online. I'll post some links to this after my section to some of our materials. And I guess it's just important to know in terms of updates, the team have done a lot of work in developing different products around interoperability. So this includes around metadata with RO crates and sending querying messages from a central node through a submission layer to various other nodes. And we're really seeing a shift in our program from developing these solutions to solve the technical problem and starting to engage with these communities, especially TREs, and understanding these non-technical requirements. So how can we capture and ensure we're incorporating appropriate governance controls and disclosure controls? So if you are interested in learning more, definitely get involved with the team. Again, I'll post some links, but these are a few channels, I guess, we have to engage with us. So email, as most have, or if you found your way to our webinar this morning, it's great to sort of hear from me or from Graciela what we're doing, but also how we're working with others. On a more technical level, if you're interested in how some of our solutions work, we'll definitely welcome you to our drop-in sessions. So it's on every third Tuesday of the month, and sort of invites the sort of dev team to speak across the sites, some of the features or updates that are there. And if you can't make it to any of those, we also have all this available through GitHub, so as a public roadmap where you can post questions. Okay, cool. So that's a quick update. I'll post those links to the chat. And yeah, if you're looking to hear more about the program, definitely reach out. Thanks, Ross.
Thank you, Jonah. Another thing that's probably worth saying is we are at the point of maturity in FedA that we'll be very keen at engaging with potential users to try and understand the type of analysis users of TREs would like to adopt. So if you would like to get involved and have a conversation with us, please get in touch with Jonah or with the email that we have. and we'll be happy to have a chat and see how we can have conversations and collaborations on that. Now we're going to the most exciting bit, which is the talks for today. So we have two really special speakers, special guests. One is Eoghan Forde, which is Senior Technical Program Manager of HDR UK. Sorry, I pronounced his name wrong. It's Eoghan Forde. He asked me not to get it wrong, but I did. So Eoghan Forde and Ross Stiven, which is the product owner of Aridhia Informatics. Thanks very much for joining us, and over to you.
Thanks. I'm just going to share my screen. Just find my desktop, and hopefully you can see a slide show in front of me, or a presentation at least.
Yes, we can see your screen. It's not in present. Yes, that's perfect.
There you go. Just
Thank
get the laser pointer up. Yeah, so the presentation is in two parts. So I'm going to speak to begin with, and it kind of introduce something called the Common API, which we'll go into a bit more detail. And I'll give context as to how maybe the Common API come about, what projects kind of led that API coming about, and kind of then set up the scene to kind of say, you know, this is where the Common API is being used, how it helped, you know, other federated analytics programs and projects, and then Ross is going to join and kind of give a very good example of the benefit of the Common API and how it's being used in the current day. So yeah, as I was introduced, I'm Eoghan Forde. I'm a Senior Technical Program Manager at HDR UK, kind of aligned to the brain health team. But in my previous roles at Aridhia Informatics as a technical project manager, where a lot of this work comes into context. So in case you're thinking, what's Eoghan talking about? This has nothing to do with brain health. I was in a different role with a different hat on. So yeah. So to begin with, I'm going to introduce what ICODA is, or the ICODA initiative. So this was the International COVID-19 Data Alliance initiative. I don't think COVID-19 needs any introduction, but essentially this initiative aimed to develop a prototype for federated analysis to enhance privacy and ultimately enable trustworthy access to COVID-19 research data during the pandemic. So a bit of an overview to what ICODA was and what was ICODA in terms of its projects, who was involved, and what was the outputs, I guess. So the ICODA initiative was formed with 12 driver projects, primarily focused on COVID-19. You can see from this really nice figure that it was a truly global kind of initiative. We brought together researchers from over 19 different countries and ultimately 135 different researchers, whether from the same team or kind of, you know, organizations within that country. It brought together a broad range of data types from over 60 plus countries. It drove community and stakeholder engagement, and albeit the pandemic maybe didn't end in 2022, but the funding did. And so a lot of the projects completed in 2022. And as part of that kind of project completion, there was over 40 plus publications from the different driver project teams. There was publication of generic policies and processes, ultimately for wider reuse post kind of ICODA. There was dashboards created for public and policymakers to use. There was further community engagement, and I guess this also falls into that remit of community engagement. The metadata from that data was made available or fair for reuse. And then also ultimately global health data science communities were kind of practiced and ultimately established and hopefully maintain some active status to this date. And just in the corner, I've kind of pulled out a few really kind of key publications that come about through ICODA. Ones around COVID-19 resilience, and also kind of the challenges around trying to do a global initiative during a pandemic, all online. These links are here, and I guess they'll be shared with the slides, but also if you follow this link, you can see all of the 40 plus publications and the kind of breadth of what was produced and curated during this initiative. And the website also still stands. But going back to federation and the kind of federated analytics piece that I touched on the first slide, there was a spotlight driver project kind of picked to kind of spearhead this aim of creating something that would enable trustworthy and federated research. And this was the IPOP, or the International Perinatal Outcomes in the Pandemic Study. It was a project that studied ultimately the impact of COVID-19 and lockdown on perinatal outcomes across 40 plus countries. And it ultimately demonstrated how globally diverse secondary data could be harmonized, securely accessed, and analyzed to produce insights relevant to maternal and kind of pediatric health. Kind of underlying the IPOP project were some key enablers, or some key kind of technical enablers. So the iCoder workbench, which was a secure, trusted research environment, or TRE, which supported cross-border analysis, that was provided by Aridhia Informatics, who Ross is a member of, or a staff member. The iCoder Gateway, which is a centralized searchable catalog of datasets. It was a white labeling of what we all know as the HDR Gateway. So it distilled metadata based on everything that was involved in not only IPOP, but obviously iCoder as a whole. It was enabled also by the 5Cs framework, which I'm assuming many individuals on this call are aware of, but ultimately it ensured that there was this kind of globally accessible, kind of private repository of accredited researchers, and obviously, hopefully, safe project governance. And then additionally, the cell data bank. So IPOP leveraged the cell data bank to anonymize and host its anonymized data for the project. And so, yeah, thanks obviously to all the key enablers. But so in IPOP, how did we get to developing, I guess, a prototype for federated analysis, and why was it needed? So ultimately, what we wanted to achieve was researchers could send analysis to data that could potentially sit in multiple locations. As we mentioned, the data was from 40 plus different countries. It wasn't very common for all of the data to be pooled and hosted in one site, as is usually the case with any federated project. We wanted to reduce risks for sensitive data, as ultimately the data remained in place or in situ. And we didn't necessarily want to provide kind of full direct access to the data set, as is probably the same concerns for everyone on this call. We wanted to be able to process, curate, link, and analyze data from multiple sources, and ultimately give the opportunity for those that may not have the resources or the availability to do so to also contribute to IPOP. So yeah, the ultimate aims for the prototype were to pilot the use of federated analytics in a real-world example, ultimately to develop something that was scalable and ultimately reusable, such as the common API, which I'm going to introduce, and then hopefully, as we show today, extend that functionality into future projects or programs. And like iCoder in general, there's lots of really high impact publications that have come about, and they're all listed either through the outputs page, or you can see this kind of immediate one here for IPOP. So kind of now moving on to what was generated as part of the prototype. So what happened was a number of kind of key enablers, as I've already introduced, but also the researchers come together. So from the IPOP team, from the Cell Data Bank team, HDR UK, Aridhia, and ultimately some of the developers at the Alzheimer's Disease Data Initiative. And the idea was to establish an open standard for data platforms to participate in data sharing or federated data sharing. And I guess some of the key standards or principles that were set about were kind of the ability to implement once and join multiple networks, the ability to allow data partners to implement the API, or the common API as it's called, in a way that suits their circumstances, i.e., it's not one size fits all, and then ultimately encourages an ecosystem of open tools and syndication. The standards used to kind of build out this prototype kind of aligned with Open API for documenting the API, OAuth2, sorry, for API authentication, DCAP for the standard used in the metadata catalogs, as well as the task execution service for compute tasks, and then ultimately Docker containerization for script submission. And if for those that are BDI'd, you'll see there's a link here. This GitHub repo still remains, so it's under the name Federated Data Sharing, but within there's this repository named Common API, and it's the kind of all of the information regarding the Common API, which I'm going to quickly show on the next slide. So it's still there. So really what happened as part of the prototype, we did a very kind of, I guess, simple analyses to prove out that the API that had been built as this kind of test worked and allowed us to do very simple federated analysis. So if I quickly introduce some of the key enablers again, so the workbench here is this iCoder workbench. The cell data bank is the cell data bank, and I'll talk about the different numbers and kind of introduce whose role that was in this kind of prototype and kind of demonstration. Also in the box here, I've called this level 2 federation example, and Ross has a nice slide to come that will kind of detail the levels of federation in these scenarios. So this is federation 2, but there are other options. So there's simply metadata querying, and also just remote data selection. And metadata querying obviously be to query something to return the metadata and understand the data. Maybe if you have a kind of greater level of permissions, you can kind of say, does this kind of data actually exist in this data set, and return some sort of output based on that. So yeah, if I run through these steps very quickly. So I guess the first step in probably any process to do with an API is to generate a token, or a token that allows somebody to maybe query something with certain permissions. So in this kind of IPOP-based approach, a researcher, so if I say Ross, the other host today, is the researcher in this scenario, Ross would go into the iCoder workbench and maybe discover that, oh yeah, this is a really interesting data set. I think that it would be something I would like to do some research on, or at least create some summary statistics. So Ross would be able to generate or request a token, through a kind of data access request form. And this data access request would be received by the data custodians or the hosts. And in this scenario, that's the cell data bank. So they would go, okay, yes, we believe Ross is a genuine researcher. We are happy with the kind of work he wants to do, and we're happy to give him federated access that allows him to actually submit some remote queries upon a selection of our data. So in that scenario, it's approved, imagine. So step 2 then becomes step 3. So upon approval, Ross has received a kind of token that enables him to now submit a API through the command line in the iCoder workbench. What he wants to do then is kind of put his script together and containerize it in a Docker container, and then submit that through a secure API or the common API to the cell data bank. Upon receipt there, Ross's script or container will first of all select the data that he wants to run his analysis upon. So it's not a case of this container is received and it's immediately kind of attached to the source data. What would happen is the script would first say, I want this selection of data because this is what my script is with regards to. And if it's approved, then the query or the script that he has for the actual analysis is run on that kind of selection of data. So in this scenario, and in the prototype, the script was executed against a Postgres database, and some kind of very simple, for the sake of the prototype, results were generated. So maybe just some basic summary statistics. At that point, the cell data bank team would come in and review that statistic. So they may want to say, oh, we just want to check that what Ross has actually run as a kind of analysis script isn't actually trying to maybe de-identify something, or do something slightly untoward, which obviously Ross would never do. So at step 8, if the summary statistics were approved, they would be returned through the common API as approved results and received back in the iCoder workbench, so the iCoder TRE. And from there, Ross as a researcher would obviously receive those results and be able to work with them within a trusted research environment, and hopefully generate some great publications based on it. So that was a really, really high level and really quick way of saying this is what was achieved as part of this kind of IPOP prototype. Ultimately, what it did was it created a series of steps and a common API that could be used for this type of kind of basic federated analytics, but also developed further. I think one of the important things to point out here is this was very programmer level. So there was no real kind of UI to this. There wasn't this kind of like user-friendly kind of login to an app and it would be there and you just drag and drop things. You'd have to use the command line to ultimately, create your Docker containers and submit them through the API. And if you're interested in this original prototype and the original work into the common API, this publication that's linked here gives you a lot of that background information, particularly on the technology and the underlying kind of standards used to build the common API. Yeah, and obviously thanks to all of those that were involved in that prototype work. It was a lot of work and a big achievement in, I think, 1 and a bit years. So iCoder and beyond is, I guess, the best way for me to finish my talk. So as I've mentioned, during iCoder and during this IPOP prototype, the common API was kind of primarily designed for use by programmers, which is great. Nothing wrong with programmers, but obviously in the real world, not every kind of, I guess, academic team has a programmer sitting around or is available. And we all know it can get quite challenging when certain things are released and there's no maybe, nice looking UI or GUI for the academic teams to make the most of. But what I've heard from different teams is that the lessons learned from the prototype have been taken forward by a number of teams and are now integral to the development of several different programs. So one being the HDR UK Federated Analytics program. I believe Simon's mentioned that it's been, some of the learners have been integral to Trifix and Teleport. Also in the Alzheimer's disease space. So in as kind of part of the original contribution, the Alzheimer's Disease Data Initiative contributed work towards the common API as it first started. And they've now built this federated data sharing appliance for Alzheimer's disease and brain health. And it's used and kind of ingrained into a lot of the work that they do within the brain health space using their TRE called the AD Workbench. And then also FEMS, and I'm not going to try and pronounce FEMS, I'm going to leave that to Ross. But Ross is going to talk a little bit more about the FEMS federated node and how Aridhia are contributing towards that project with the common API. So Ross, if you're happy to take over,
I certainly am. Thank you, Eoghan. Hello, everyone. Yes, I'm Ross Stiven. I'm a product manager at Aridhia, as I've been introduced. My interests obviously are federation, but I also work on our metadata catalog as well. And I will do a little bit of an introduction to that as well, so you can understand the flow when we're talking about integrations. So I'm just going to share my screen. If you give me a second, and I'll take up the story. Can everybody see my slides?
Yes.
Excellent, thank you. Really, I'm going to largely pick up the story where Eoghan left off and explain how we've taken the common API and developed it, and in particular how we're using it in a project called FEMS. I am also not going to try and pronounce the full name of FEMS, as you'll see when we get to the slide which contains it. So what am I going to talk about? So I'll do a very brief introduction to Aridhia and our product, just so that you understand the kind of general flow through our TRE. I'm going to make a very brief segue into SATRA, which, if you're not familiar with it, is a DARE UK project, which defines an open specification for trusted research environments. As Eoghan said, I'll talk a little bit about our definition of data federation, because that's something that we've inherited from that iCoder Common API project. And it's just a useful way of understanding like the different varieties of federation that you could possibly do. Then I'll talk about FEMS. Then I'll talk a little bit about the federated node, the actual open source project based on the Common API. Give you an overview of how we've integrated that with our environment, and talk about the slightly novel way that we're using it with FEMS, where we're actually using outbound connections to do federation from the secure environments. And fingers crossed, I'm going to give you a very, very short demo of it's only the MVP dashboard for FEMS, but it should give you a good idea of what the final product will look like. So without further ado, so as I said, Aridhia, our product, is the Aridhia DRE, which is a trusted research environment. It has two components. The first one, which you can see here, is FAIR, which is our metadata catalog. For the purposes of this presentation, the most important thing is that FAIR is the mechanism by which we approve access to data within the DRE. So users come in, browse the catalog. If there's a data set they're interested in, they can submit a data access request via FAIR. That is then, the data owner is then alerted, and they can either approve or reject that request. if the request is approved, then the requester now has the ability to push their data into a workspace, which is the secure environment where like users perform their analysis. So that's really the bit I think most people think about when they think about a TRE. Yeah, our workspaces contain all the sort of tooling you would expect. So we have things like RStudio and Jupyter Notebook and our own data table analytics, but obviously a lot of that is kind of rendered moot when we're talking about data federation. So how do we marry these two things up? Yeah, as I said very quickly, mainly just because I always do this when I get the chance to speak at these things. SATRA is an open specification for trusted research environments. It was developed by Dare UK. Both myself and the company at large are big fans of this. We think anyone who is either using or thinking about using or is a provider of a trusted research environment should really look at SATRA. It's a very useful explainer as to all of the things that you have to do to successfully run and support a trusted research environment. I mention it particularly in this context because one of the things that we do think is a gap in it is that it doesn't say anything about federation. So how do trusted research environments fit into a federated network? I do know that that's something that the authors of the specification are actually actively looking to remedy. So I quite look forward to see how they fill that gap within the specification. Yes, so how do we define data federation? So this is what Eoghan was talking about earlier. And as I said, like we pretty much have inherited this wholesale from the Common API. So we define federation as 3 levels. So level 0 is no federation. That's the workflow that I just described through the DRE. So a user requests access to a data set, and when access is given, they just transfer an open copy of that data set into their workspace where they can perform their analysis. That's level 0, no federation. Level 1, I think this is really what Eoghan referred to as remote data selection. So the user requests access to a data set, and then rather than being given a whole copy of it, what they actually get is the ability to query one or more remote databases and then return records which match their queries. So that's obviously a slightly different mechanism for accessing the data, but ultimately the user still ends up with record level data that they can perform direct analysis on. So I think technically that's different, but perhaps from an end user's perspective, things don't change that much between level 0 and level 1. So level 2 in our schema is the final level of federation and is really what I'm going to be talking about for the rest of this presentation. So level 2, I think inarguably is substantially different from what historically data analysis has been. So level 2 is the user can still browse a metadata catalog and discover data sets that they're interested in, request access to those, but if access is granted, what they actually have permission to do is to write some analytical code, send that to the data owner who then runs it in their secure environment, and then receive back aggregate results of their analysis without ever having seen any record level data. And I think everyone would agree that that's a very different way of working. So yes, FEMS. Yeah, just to Eoghan's point, I am not going to say the full name of FEMS because that's it there. So FEMS is a Europe-wide consortium of paediatric hospitals, many of them sort of national centres of excellence, and they want to continue to collaborate on various data sharing projects. And the reason that they're interested in federation is that, like everybody else, they are subject to GDPR, and in some cases, even more restrictive national data protection legislation. I think, certainly I do, and I know that everyone in the consortium absolutely understands the need for data protection legislation, but it does make it more of a challenge to collaborate across borders. So the 2 technical solutions that FEMS is exploring to sort of meet the challenge of continue to collaborate while meeting their obligations under the various laws are data synthesization and data federation. We're involved a little bit in the synthetic data side, but our primary sort of involvement in FEMS is really around federation, and that's what I'm going to talk about. So FEMS, from a data federation perspective, have 2 high-level use cases. which we call federated analysis and federated learning. The federated analysis is primarily about sharing clinical benchmarking data, so allowing the members of the network to compare their outcomes across various sort of treatments and various procedures. And I think, that doesn't take much selling. That, it feels like an obvious good that if one hospital in the network, say, has a 5 or 10% better success rate on a given procedure, then the other members can see that. And that can then be the basis of a conversation that allows them to share what it is they do that the others don't, or what it is that they know that the others don't. And you can just spread sort of good clinical practice around that network. And the federated analytics really just are the seed of that conversation. So I think that's really good. We pretty much can already do this. So like technically the FEMS network that exists and can like perform this type of analysis. And really now it's just about getting the harmonized data and the desired analytics in place. But like technically, like we can do use case 1, and I think that's a really good success for FEMS. Use case 2 is not as mature. We've still got, I think, about 14 months to deliver that. So use case 2 is about essentially about pulling their data to train federated learning models that will help them build predictive algorithms for the emergence of sepsis and haemophilia within patients. We have a proof of concept that will allow us to run ML type code in the remote environment, but we haven't done this across the network yet. If you invite me back to speak again in 6 months, I might have something a bit more compelling to say about use case 2, but we're still developing it just now. Yeah, so Eoghan has already mentioned the federated node. He certainly mentioned the common API. So this is our biggest direct contribution to FEMS. We've taken the common API and essentially built it as a deployable piece of software. It's very purposefully been developed as a component rather than a framework. So it is simply the engine that will let you run your federated tasks. We assume that anyone who wants to deploy it has their own ecosystem that they can integrate it with. So we assume that you will already have things like bar requests or UIs for submitting tasks and returning results and things like that. It's an open source project, as was the common API. There's a link to it at the end of the slide. If you are interested, please have a look at it and feel free to raise issues or leave us comments. Yeah, so that's in production. We reached version 1 in May, and we're going to be continuing to develop that for the FEMS project and I hope beyond. So one of the first things that we did once we had a stable version of the federated node, and I think this really carries on from what Eoghan was talking about around the iCoda network. So this is like I guess what we would say is like a production version of that iCoda prototype. And what it's allowed us to do is we can deploy a federated node with some remote data. We can create a record for that in our metadata catalog FAIR. The data owner can actually self-serve the connection to the federated node. So if they have the appropriate credentials, they can just say, this is a federated data set and here is its location. And at that point, a user is able to submit a data access request, which will be fully audited through our DAR process for access to the federated data. If that's approved, the federated node issues an auth token, which is then pushed into a secure workspace from which the user can then interact with the federated node. So what we've done is kind of wrap the federated node in a fully audited workflow. So I think that's quite nice. We wrote a paper about that, which you can see on this link. But this is actually not what we're doing for FEMS. We're doing something a little bit different, which I'll get to in a minute. The one thing I will say is that we built that integration framework on the assumption that people would want to use other, because obviously there are a variety of different federation frameworks out there. So we assume that our users will want to interact with other frameworks, but use that same secure wraparound that having an audited DAR process and secure workspaces gives you. These are just some of the things that we've looked at. I think we're very confident that we could do data shield. We've already done a project with Vantage 6 as well, with machine learning frameworks with like Flower or Substra or something like that. I don't think we completely know what the answer to that is yet, but I think it's a solvable problem in terms of like how that workflow would work. Yeah, so this is what we're actually doing for FEM. So like I say, it's a little bit different to what I guess we would consider our standard deployment. So FEM's had a couple of things that they wanted to try as part of the development of the network. So the first thing, I'll put number 1 there, is that they wanted to use GitHub as both the source of analytical code and also the means by which that code would be approved to be run. And the other stipulation was that the partners did not want to open up their secure networks to inbound connections. They wanted everything to be managed via outbound connections from their secure environment. So the way that this works is that if a user wants to submit some code to run on the FEMS network, they open a PR in the central FEMS GitHub repo, which has been set up. The data owners, so the people in charge of these secure environments, can review that code in GitHub, and if they're happy with it, they can approve the PR. Once the PR has been approved, Argo CD, which you can see here, has been deployed as a listener. So it listens to the appropriate branches of that GitHub repo. And when a PR has been merged, it knows to pull the code in, and then that's run in the secure environment in the same way that it would be if we had inbound connections. Once the results have been reviewed and approved, they can then be pushed out to a secure workspace where we have a dashboard that will allow any users of that workspace to view the aggregate results of that federated analysis. And I'm hopefully going to quickly show you that just now. Can everybody see the new screen that I'm on?
Yes.
Yeah.
Good. That was my biggest worry. Excellent. So this is not the complete. This is not the final FEMS dashboard that's being deployed, I think, this month. This is just something that could analyze the actual data, but just some very basic sort of visualizations and things like that. But the idea would be this, that most users wouldn't interact with the federated network. Most users would interact with it at the level of the dashboard. So they can come in, they can toggle the procedures and see what those are like, and they can also add and remove other hospitals. So this is currently hosted in one of our workspaces. It probably is going to remain the case that it will be hosted in there for at least until now, until the end of the project, and what happens after that is open for discussion. But we're certainly going to be using our workspaces as the host for these dashboards for the MVP period. So I'm going to quickly go back to my slides. Yeah, this was just in case it didn't work, but there's a screenshot of it. And that's kind of me. In terms of things that we're going to be working on in future, we're certainly going to be developing the FEMS use cases, particularly around the machine learning side of things. Probably the most interesting thing from this audience and the most relevant thing to some of the things Eoghan was discussing. We're actually involved in the DARE UK Treevolution project. So part of that is looking at integrating federated analytics based on the task execution service with trusted research environments. And as Eoghan already mentioned, the common API is based on the GA4GH task execution service. So we're going to be working with them to understand how we can make that process like much slicker. How can we make it easier for people to stand up federated networks using a trusted research environment? Yeah, I've got some resources here, like please check out FEMS and the federated node. And if you have any questions after the presentation, feel free to get in touch with me. Thank you very much. Stop sharing my screen just now.
Thank you very much, Ross. I have a question for you from Tony. He's asking if L1 is the same thing as data discovery cohorting?
Not necessarily, possibly a bit like cohorting. Arguably a bit like cohorting. It's not really data discovery. I think from our perspective, it would be more like we've given you permission already to like query the remote data store and return whichever records you feel you need. So I don't think we would call it data discovery. I think it's past that, but I think it's somewhat equivalent to like cohorting, yes.
So is this tech interoperable with the GA4GH beacon framework?
There's no reason it couldn't be, and it is something that we've discussed. Like there's no reason that we couldn't have a beacon endpoint. Whether it would be exactly like the GA4GH beacon, which I know is very focused on genomics, but like we have certainly discussed having something like that, even if it wasn't exactly the GA4GH standard.
Can you comment on data standardization or common data models and how they fit into this work? And
yes, absolutely. So FEMS has chosen OMOP as the common data model, and the partners have all harmonized, certainly for the clinical benchmarking statistics. They've done their harmonization into OMOP for that. I believe there is still some work to do on the data that they're going to use for the machine learning side of things.
I have one question around the pipelines and the design of the architecture you have, because you said that at some point there is the data transfer. So after the requisition, there is the data transfer so that the users can analyze it. Is this data transferred to somewhat of a container and is the data from multiple sites? I don't understand how the federation.
So with our approach to federation, there is no data transfer. If you're talking about how the DRE works,
When you create the virtual database for the user to be able to interrogate the data in.
okay, yeah. So we don't actually do that. We respect the common API framework and describe what we're doing as level 2, but currently we don't actually provide that level 1 type federation just now.
Okay, yeah.
Yeah.
So how what in your interface when you have the summarization of results, what is the process of disclosure control that you're using at the moment?
Yes. So there's a couple of ways that the FEMS partners can do it. So the example I showed you there, we're actually correlating results from 2 sources. So we have an inbuilt review mechanism within the federated node itself. So a reviewer, the data owner can like switch on the review process, and that allows them to review the results before they're released. They just call the API and pull the results out themselves at this point in time. And then if they're happy with that, they can approve it and it's pushed out to the workspace. The FEMS specific element, FEMS also have a review process, so you can do it via the GitHub repo. So we can push the results back into GitHub, and some of the partners are doing that. So the results are in GitHub, and then they release them from there. And we actually have a way of ingesting those results back into the workspace. So if we're coming from different sources, we can display everything in one dashboard.
When you're using machine learning, I don't know if you're there yet, and you have the PR to be able to check the content models. Is there any process that you're using at the moment?
No, we're not there yet. We're not there yet. Like, so we're at effectively the point we're at with our proof of concept is that we could run a machine learning model on that sort of inbound infrastructure. I don't have an answer yet as to how we're going to work that with GitHub. And it's one of the open questions. I'm confident that we'll come up with something that works, but we don't have a definite answer to that yet.
I would be very interesting to know and to invite you again to talk about it once you guys have figured it out, because it's
like I say, I think if we were to come back in 6 months, we'll have a lot more to say about the machine learning side of it. Yeah.
Thank you, Ross. Now, for Owen, a few follow-up questions. So there was a question about the iCoded data set and if it's publicly available as open source. So you put in the chat a link for the metadata that can be found in the HDR gateway, but just if you could elaborate a little bit on that for the audience that quite doesn't understand how the access to these data sets take place. So you can find the data set, but then there are other agreements for you to have access to that, isn't it?
Yeah, so the agreements would probably go through the individual partner that's contributed that data set. So if I quickly look on the other screen, there are 20 data sets listed on that gateway listing. So my assumption would be maybe a few of them would be the same data owner or custodian, but then obviously you'd go through the individual process to make a data request. But also as part of that gateway listing, there's also analysis scripts and software. So and also the dashboards are listed there. So there's lots of information about all of the outputs that come about from iCoda.
Yeah, so that was going to be my follow-up question. So if people are interested to know what was the federated analytics that took place with that data set, the scripts would be available.
Yeah, and actually some of the kind of prototype, so in that prototype publication, I also shared a link for, there's more detail about some of the test APIs and the tasks submitted. So there's some good insights as to what we did as part of that piece of work. So, but the actual prototype study was kind of very low, not low level, but very simple summary statistics. It wasn't a kind of fully fledged study of sorts.
So for the summary statistics that took place, how does the system perform the disclosure control? Is also manually checked?
Yeah, it was manually checked.
Lovely. I don't think I have any other questions, but thank you very, very much for the presentation. This has been great, and I think there's loads of food for thought and loads of resources for us to have a look at. So thanks for today, and thanks everybody for attending today. If you have any further questions, just get in touch with us and we'll be able to follow up with them.